Now we're going to go to the land of controversy because everybody knows vitamin D is swell and you ought to take it, but I've not seen the evidence of that. And so I'm going to talk about it a little bit because it's being talked about as something it's accelerated during the last 3 years, something everybody should be taking. Vitamin D is measured with a blood test, and it's produced via sun exposure or consumed in foods and supplements, fortified foods and supplements. It does not naturally occur in food. According to the Institute of Medicine, it's not clear that blood markers are a marker for health status at all, or that increased levels are a measurement of health improvement. And the other thing is that we have gotten into this very bad habit, in my opinion, of measuring plasma levels of vitamin D without any consideration for the fact that it's stored in the fat tissue. And vitamin D is not a vitamin, it's actually a hormone. And this is an important thing. The medical definition of a vitamin is something that your body cannot produce and it must be consumed in food. And so your body produces vitamin D in response to sunlight, and it's not in food. So this is kind of a bizarre perversion of what we know that's caught on, like a whole lot of other things in healthcare. The error rate for testing is really high, that in favor of overdiagnosing deficiency. The lab tests don't measure vitamin D binding protein, which can vary significantly. And also the tests do not account, when you look at all these studies about deficiency, you've got inflated biomarkers or reference ranges, and you also have no consideration for the time of day. And vitamin D levels fluctuate predictably throughout the day. So without knowing, they're higher at some points and lower at some points. So when you start reading these studies, I want you to keep in mind that that's not been accounted for most of the time. And this is an example here. This is a case report. There are a lot of these, and the reason I use it's a weak form of evidence, but it makes a specific point that I want to make here. And that is that time of day that the sample is drawn affects outcomes. So here's a healthy woman in her 40s taking 5,000 international units of vitamin D daily at midday for over a year, which is mild compared to the horse-like doses that are being prescribed now. Her plasma levels got to 60. She lived in California, got a little bit of sun every day in the morning, and little vitamin D intake from any other source. Her plasma levels were tested 3 times a day, and at midday, they were lower than in the morning and 13% lower than at night. Her vitamin D levels fell by 25% the day before she contracted a cold, in spite of the fact that she never stopped taking the supplement. It was consistent with what we know really is going on, which is reverse causation. I'll talk about that in a minute. Without any change in her dose, her levels returned to baseline 2 weeks later after she recovered from the cold. The case report confirms previous studies showing that lower levels of vitamin D are a consequence, not a cause of disease. It confirms other studies showing that the time of day matters, but it is not accounted for in these studies. And it shows that supplementation has little to do with status. Taking the supplement didn't prevent the cold. Taking vitamin D while the patient had a cold made no difference, and levels didn't increase to normal. They just went back to normal without any intervention in 2 weeks because the intervention never changed. So reverse causation, I'll just talk about this for a minute. There's a connection between low vitamin D levels and disease. People have inaccurately reported that to mean that lower levels of vitamin D cause disease. Well, an association should never be confused for a cause and effect relationship. It's just not the same. And I'll give you an association. In countries where more women are getting driver's licenses, the breast cancer rate's going up. Well, I guess if we're going to use association, we should start taking driver's licenses away from women. I don't know many women who would consent to that, but that would make sense if we're going to use association, all right? The problem is that intervention studies and prospective studies where vitamin D has been used have simply shown no benefit in general. And I'm going to show you what I mean by no benefit. People jump on me when I say this. Raising your plasma levels is not a benefit. Pretty blood work is not the objective of health. It's better health, it's lower risk of disease or recovery from disease, etc. All right, so, but we do see lots of evidence of reverse causation. They just showed it to you. Another example that I'll talk about is that patients who arrived at an emergency room in a hyperglycemic state, where their plasma levels of vitamin D when they arrived were 12.3, and as soon as their glucose stabilized, they went up, in a matter of hours, went up to over 28. So it was the disease causing the low vitamin D levels, not low vitamin D causing the disease. So this is a very convoluted, crazy thing that has happened. It's a $1 billion industry based on this false premise. All right, so let's look at studies cited by advocates. All right, and I look them up and I read what they say. All right, so here's the first one: 4,628 people with vitamin D status measured a year before COVID testing. The risk of positive test for Black people was 2.64 times greater with vitamin D of 40 or more than, or 39.9 than 40 or more. The issues are, first of all, it's observation, no cause and effect relationship established. And there's so many things that could have to do with this besides vitamin D. A study in Northern Italy, retrospective analysis of vitamin D levels for 347 patients admitted to the hospital with suspected COVID-19. 128 tested positive, 219 negative. Average vitamin D levels were the same in both groups. Also, the percentage with D levels under a threshold, same in both groups. And so here's the conclusion. These are studies that advocates say show that you need vitamin D because a large portion of patients were below the suggested 30 nanograms. We can't exclude that vitamin D supplementation, restoring normal levels, might be beneficial in reducing the risk of infection. And notice that at this point in time, they were saying 30 is the threshold. Most reference ranges are up to 50 to 100. Pretty soon it's going to be 500 to 1,000, and you should be taking a bath and stuff. I mean, the trend is incredibly alarming to me, mainly because it's a hormone and it's stored in the fat tissue, and the reference ranges keep going up and the doses keep going up with weak evidence like this to support it. Here's another one, a review article. This narrative review aims at collecting the literature available on the involvement of vitamin D status and the pathogenesis of COVID-19. All right. It emerges that, and this is again, I want you to pay attention to the language, that a poor vitamin D status seems to associate with an increased risk of infection, whereas age, gender, and comorbidities seem to play a more important role. Vitamin D supplementation may be useful. Now, you're an advocate for vitamin D. You're telling people they all need to take it to stay healthy, and particularly if you want to avoid SARS-CoV-2 or recover. If this is the most convincing stuff you can put in front of me, I'm just not convinced. Another study, hospital data for 235 patients with COVID-19, 74% had severe infection, 32.8% vitamin D deficient based on the inflated numbers that we can talk about if you want. A significant association between vitamin D sufficiency and reduction in clinical severity, inpatient mortality, serum levels, or C-reactive protein, and an increase in lymphocyte percentage. And then this significant reduction suggests that vitamin D sufficiency also may help modulate. Do you see all the qualifying language? All right. And by the way, if you want to take vitamin D, all great. I just think I'm an advocate for informed consent. And too many people are doing things every day or sporadically. They have no idea what they're doing, why they're doing it, or if it has any effect. Here's another one. We cannot explain, this is cited by advocates, all right? We cannot explain the cause and effect relationship of vitamin D sufficiency and the reduced risk of severity from a COVID-19 infection. If you can't identify a mechanism of action, that needs to be disclosed. We have no idea. Here's what the summary so far, what I've shown you. We don't know if it works. We don't know why it works, if it works, but y'all ought to take it because it's swell stuff. So the studies are focused on observation that people with COVID-19 have lower levels of vitamin D. Well, people with many conditions have lower levels. The reverse causation, remember the woman with the cold I showed you. No accounting for the limitation of testing methods used, and most likely due to reverse causation. People with lower levels of vitamin D have lower levels, are sick, who have lower levels of vitamin D, or because they are sick. It's reverse causation. So the last supplement, I think it's the last one that I'll cover, is zinc. It's an important nutrient. Cellular metabolism is the process by which cells grow and reproduce and differentiate. It enables the activity of hundreds of enzymes. It increases the response rate of immune cells. It can directly fight some viruses. Zinc deficiency is reported to be common in elderly people and those with chronic illness, and it has a known effect on taste and smell. A Cochrane review, 16 intervention trials, 2 preventive trials. Taking zinc within 24 hours of onset of symptoms reduces duration of symptoms in healthy people. It didn't reduce severity of symptoms. Risk of developing a cold reduced. Prescribing of antibiotics was lower in the zinc group. Side effects, bad taste, and nausea. But high heterogeneity means that average estimates must be viewed with caution. So this study showed some positive results, but the researchers were quick to say that these estimates must be observed with caution. And by the way, you can never use one study to justify doing something anyway. A review of 14 studies, 4 out of 14 met all criteria established by the researcher, and 3 out of 4 showed no benefit. 1 showed a slight benefit with nasal gel. The remaining 10 studies, 6 reported benefit. The authors commented that zinc research is inadequate and more research is needed. How zinc may improve outcomes for SARS-CoV-2. It may decrease activity of the ACE2, which is a known receptor for SARS-CoV-2. Notice the qualifying language may upregulate interferon production and increase antiviral activity, has anti-inflammatory activity, may modulate T-cell activity, which can limit cytokine storm, more common in COVID, and has an antibacterial effect. So notice the qualifying language. A study of 242 hospitalized COVID-19 patients, 81% received supplemental zinc, the daily dose 440 milligrams. There was no relationship between zinc and survival. And the authors said, even this, you have to be cautious because the sample size was small and there were a lot of confounding factors. And that's one of the problems you see, by the way, in the vitamin D studies, is there's no accounting for confounding factors in a vast majority of the studies. Literature review, zinc and viral infections. Zinc supplementation improves mucociliary clearance, strengthens epithelial integrity, decreases viral replication, promotes antiviral immunity, regulates inflammation, has antioxidant effects. It can reduce lung damage, minimize secondary infections. High-risk patients for COVID, like the elderly and people with chronic disease, might benefit. It is inexpensive and it has few side effects. I would add the caution. This is not instead of doing everything else that we talked about here. The likelihood that a diabetic, overweight, hypertensive person who's 80 years old and bedridden is going to fix it with zinc is about 0. And we just have to recognize that. A study of 191 patients in Egypt, 96 received HCQ with zinc, 95 HCQ only. And the recovery rate was about the same. So it's said that zinc is an ionophore that gets drugs into the cell. Doesn't appear to make that much of a difference. 214 COVID patients outside the hospital, average age 45, 4 groups, 50 milligrams, 8,000 milligram of zinc gluconate, 8,000 milligrams of ascorbic acid, both are standard of care. Standard of care, 50% symptom reduction, an average of 6.7 days. It was 5.5 days for ascorbic acid or vitamin C, 5.9 days for zinc, 5.5 days for both. It was not statistically significant. So I would say if we're looking at the preponderance of the evidence, it's actually not very convincing. A New York study, 3,473 patients, average age 64 with COVID, diagnosed with PCR test. 522 patients vented, 545 of them died, 545 died. 29% received zinc plus ionophore, 24% reduction in the risk of dying in the hospital. More patients were discharged to home care with zinc. And so again, what this may be saying, and I'm willing to acknowledge this, is that there is a small percentage of people who may benefit from zinc. There is a tiny subset of patients that may benefit from vitamin D. The problem I have with a lot of this is it soon turns into everybody and always instead of small subpopulation and sometimes, right? So I've often said, when I talk about cancer, people are often shocked to find out that I sometimes agree with a patient's decision to get chemotherapy. They say, well, what kind of naturopath are you? I'm an evidence-based naturopath, and sometimes chemotherapy makes sense. It's the stupid use of it that is a problem. And it's the use of it without anything else that is the problem. So I guess what I'm saying here is the stupid and broad use of these supplements and the broad recommendation of these supplements is very problematic in my opinion. And another thing I'll say before I finish up here is that the supplements you have to be the most careful of are the ones that work, because here's what we know. Any substance that you take in that works, there will be a side effect. If there's an effect, there's a side effect. And the fact that it hasn't been well studied and we don't know all the side effects doesn't mean that there isn't something lurking there. I mean, medicine is full of a long history of doing things that turned out to be a really bad idea. Didn't know going in, throw caution to the wind, and turned out to be a very bad idea. So I err on the side of caution, which makes me an outlier in my field. A literature review, indirect evidence suggests that zinc may potentially reduce the risk, duration, and severity of SARS-CoV-2 infection, particularly for populations at risk of zinc deficiency. But I promise you, if you spend some time this afternoon looking for even case reports for zinc deficiency, you will spend all afternoon and not find very much. Direct evidence is pending. So again, it's just not very convincing. Cohort of 249 hospitalized patients, lower levels of zinc were correlated with higher inflammatory response. Patients with higher serum levels had shorter time to recover. So again, I think that there may be subpopulations of people who benefit from this. I'm cautioning against the everybody prescription. So just to summarize, I want to get to your questions and turn this into a discussion, because I've sure given you a boatload of information here. Health promoting habits increase immune function. Healthy people neutralize viruses and bacteria most of the time without assistance. Conversely, unhealthy people are more likely to get sick, more likely to remain sick longer, have severe symptoms, and require intervention. So what you want to do is you want to put yourself in a position where you're less likely to get sick. If you do get sick, it's a non-event, and you're quickly back on your feet, back to normal, and then live your full life as an independent person. That's my goal. If I have the good fortune, I hope I do, because I have a lot of stuff I want to accomplish in life, to live to be 100. I want to do it living on my own and being productive until the very end. And that only comes with gaining some knowledge about how your body works, gaining some confidence in your body's ability to maintain and fix itself, and adopting and maintaining really, really good habits. So I am happy to take questions from you guys now.